My name is Ivana Dancy. I'm 20 years old and I'm a junior at North Carolina Central University.
So my name is Alyssa Pay. I am 20 years old and I am a full-time student.
My name is Caroline Carter. I'm 22 years old. I am a full-time student and a full-time employee.
So my name is Diego Sid. I'm 20 years old and I go to UNC Charlotte.
My name is Tyreek McCrimmon. I'm 23 years old. I'm a full-time college student. I am a biology student. My experience with clinical trials was last year, December 2nd. It was a kidney surgery, kidney donation. So basically they would ask me stuff like on the scale of 1 to 10, could you do like house cleaning activities? Could you vacuum? Could you mow the grass? Stuff like that.
So the only clinical trial that I've experienced was one at my job, and it was more of a cosmetic one. So we had a representative from the brand Dermalogica come in and give us a sneak peek to their new vitamin C line. And after we signed a few waivers and after we went over a lot of skincare tips, we got to bring home packets and try it out for a week. And then we gave her our results with how it changed our skin.
I was in high school and I had a bit of acne, and my mom saw actually that there was a clinical trial going on. There wasn't many details on it. It was just supposed to see if it would help acne opposed to taking pills or medication. It was supposed to be kind of a laser therapy. So that was the first introduction I kind of had to my clinical trial.
I've had a couple of experiences with the clinical trials. I was at UNC Charlotte. This was about my freshman or sophomore year there. So this is about 2018, 2019. I was in the bathroom. I saw a little tab thingy, and it was, if you have these things. So it was like, if you're black, diabetes runs in your family history, then, come and do the case study for us or whatnot. I went to it. They were given a gift card for it. So of course I went to it.
My experience with clinical trials happened about 4 years ago when I was a junior in high school. It was with Duke University, and it was a teen sleep study. So I believe that they were measuring the sleep habits and just tracking the sleep schedule of teenagers, some with ADHD and some without ADHD.
I did not feel like I had an obligation to complete anything. When I was in pain, they dealt with me and they were like, okay, well, maybe we can turn it down a bit.
Yeah, so you could definitely leave at any time. They gave you that option, and they always ask every single week. If you want to opt out, you could.
I didn't feel pressured. The questions on there, it was 3 choices. You could do a true, false, or choose not to answer it, or just leave it blank. The questions were so broad, you didn't have to answer every single one, basically. And if you did feel uncomfortable with one, you could have not answered it or decided to decline the clinical trial.
To complete the results they wanted to see in the study, they did have to push me a little bit, which I understood and I was okay with. So I think the pain level, they definitely dealt with me and they helped me, and they won't do anything I'm not comfortable with. But also it was a matter of, okay, you're too comfortable with it. We have to, turn it up a bit just to see if you will produce the results we want to see. So
my actual experience went really well because everything was explained to me. I was able to ask any questions that I needed to ask. And of course, I could just stop using the products whenever I wanted.